If you have a belly sticking out, you have a problem because the fat that's in the stomach, that's called visceral fat. This is very detrimental fat. And that's the epidemic that we have today. But the only thing that will make you lose that fat very quickly, this is crucial. Glucose actually is toxic inside the bloodstream, and the body causes insulin into the bloodstream to push glucose out. But frequent consumption of carbs, sugar, processed foods is causing insulin to stay up, which can lead to insulin resistance, and you're going to be more prone to heart disease, which is the #1 cause of death all over the world right now. But this is where fasting comes in, because after 12 hours you start pulling the fat out. And the first place the fat comes out of is going to be visceral fat. But with modern living, we have lost this physiology of fasting. So we'll go into that. And there must be certain things which people aren't aware aren't healthy as it relates to my cardiovascular health. Yes, so I see that people who overly do aerobic activity, they end up with more coronary artery disease than patients who do short sprints and resistance exercises. Then there's mold. And almost 70% of homes these days have some form of mold toxicity in them. But also one night of bad sleep, you become insulin resistant the next day. And there's calcium supplements, excessive fruit, white rice. White rice. You'll be surprised how much arsenic there's in rice these days. I watch a lot of true crime. People kill each other with arsenic. Yes, and it'll slowly kill you. And lastly, this is going to surprise you. Focusing on prevention of heart disease, which is the #1 cause of death all over the world right now. You see, the heart is made up of many parts. So this is important. It's a pump. So it's a muscle. So you have diseases of the muscle, and it's rampant these days. Cardiomyopathy, weakness of the muscle. Then you have the arteries on top of the heart, and that's called coronary artery disease. Diseases of the arteries, they block up. Then you have the valves. The valves tend to get damaged as well. For example, aortic stenosis. And then you have the peripheral circulation. All the blood vessels that go to your carotids, your brain, your legs, and to all the organs of your body. And then you have microvascular disease, which is the tiny capillaries that they become dysfunctional as well. What's a capillary? Capillary is the branch of the branch of the branch. Okay, so like the tiny little veins, final ones. Yeah, so when they become dysfunctional, that organ becomes dysfunctional as well. So cardiology affects all these aspects. Now the mind-blowing data from Dr. Pradeep. And how long have you been operating on people's hearts? About 35 years now. And how many hearts do you think you've treated? In excess of 30,000. And what's the age range of those patients? They were used to be mostly older people over 65. Now I would say 50% of them are under 65 and 50% are over 65. So the demographics is changing. The younger people are developing heart disease. So, the youngest patient you've ever treated? 28. A heart attack is when a minor blockage which is not causing much flow disturbance suddenly cracks, and what was the predicament in that case? He was having a full-blown heart attack. So, that means that one of his arteries was completely clogged up. It had a blood clot in it. There was no circulation past that artery, and therefore he was having acute chest pain, sweating, blood pressure was low. He comes straight to the hospital. I rush to the hospital, take him straight into the cath lab, and try to open up that blockage. And we did open up that blockage and put a stent in it and got rid of that blockage immediately to restore that blood flow to the heart muscle. And at 28, how does one get a heart attack? You said it was blocked up. There's a lot of nuance. Most people don't understand what a heart attack is. So, in a nutshell, I'm going to tell you what it is. When you have a plaque is a buildup of a little fibrous material inside the artery, and that doesn't cause a heart attack. A heart attack is caused when one of those plaques cracks. Now in this diagram, for example, it's showing that the plaque is closing up the artery, and this will cause angina. That means a lack of blood supply over here. So this patient may complain of chest discomfort, or he may not complain of chest discomfort, because remember, when you have a blockage like this, only 20% of the patients actually get chest pain. That means that you could have a blockage like this in a patient, and you may not have any chest discomfort, and the only way you're going to pick that up is by doing a stress test, or a coronary calcium score, or some other modality to see whether he has blockage or not. It happens to the plaque that cracks off, And when it cracks open, the blood that's going past it sees the crack and wants to repair it and forms a blood clot on it. So the final thing that shuts down that artery is a blood clot. It's not the plaque that shuts it off, it's a blood clot. So a heart attack is caused by a blood clot at the site of a rupture, and what causes rupture is inflammation. Okay, so when people say that heart disease is the #1 killer of people generally that are diseased, is it that process that's causing it alone, or is there a multitude of processes that lead to heart disease? There's a multitude of things that lead to heart disease. Look, that was a heart attack. That's right. So, 1. You're making plaque. You shouldn't be making plaque. A plaque is an inflammatory area inside your arteries. It's reacting to something. And I can go into the nuance of what's the body reacting to? What's inflammation? Inflammation is reacting to something. What is that something? And I think it's important for your audience and everybody to know what that something is. Now, you've got this pimple. Think of it as a pimple on the inside of the artery. Now, one day when there's enough inflammation in your body systemically, that pimple is going to crack open just like a pimple on the skin breaks open. Now, that artery has this little pimple on the inside and it cracks open and a blood clot forms on it, and that's a heart attack. So, you don't want plaque formation. You don't want plaque instability, which is rupture of that plaque, and you don't want a blood clot to form on it. There are factors that affect each of these processes, and all 3 processes are going wrong today, and that's why we have so much plaque formation and instability of the plaque, which then leads, of course, to heart attacks and our blood in general. We have more coagulation issues today than we ever did before, which means our blood, because of inflammation, is more ready to clot more easily. So we having the perfect triad. It's the perfect storm. That's why we're seeing an epidemic of this. And that's why we're not making a dent in it. Yes, you can have a plaque rupture and have a heart attack, and we put a stent in you. Okay, that's fine. But what did we do to look at the underlying reason as to why you formed that plaque, and why did you rupture it? And why was your blood so clotty in the first place that made you actually seal off the artery? Is this an increasing problem? Yes. It's a huge problem because those factors have been identified now, and that's what we go for in my practice. We look for the factors. Why did you make this plaque? Why is there so much inflammation in your body? Inflammation is a reaction to something foreign. What is that foreign stuff? What is that abnormal physiology in you that your body is reacting against? Because that's what inflammation is. And inflammation, of course, whenever there's going to be inflammation, there's going to be increased. And I think it's important for your